Ghassan, we've talked about some of the procedures that we have, right? So we have these surgical procedures, we have these local regional therapies, but one of the areas that we've seen the most dramatic advances and some of the most exciting advances in terms of liver cancer has been in the systemic therapy route. So, I'm hoping that you'll be able to walk us through several of the different options that we have available for systemic therapies. What do we have that are targeted therapies? What are targeted therapies? How are they used to treat liver cancer?
Yeah, I mean, I will first reconfirm what you said earlier. Chemotherapy, we don't treat with chemotherapy liver cancer. Rare occasions, but really it's not the standard. It didn't work for that disease. But thankfully, the science that has been evolving over the last 2 decades have found what we call targeted therapy. In other words, think about it this way. You have a certain specific change in that genetics of that cancer cell, and you have a drug that can go and affect that specific or stop that specific change. And this is what called target therapy. Sometimes you hear the word biologic therapy, and this kind of, used alternatively in that regard. The drug that really came first, and we were really delighted to have it as the first choice of patients' treatment, was sorafenib. After that, we have lenvatinib, and there could be other choices that really evolved from that point on. They are really good therapies. Understandably, they are really able to control the cancer. They have an impact in regard to better outcome for the patients, but of course, they come with some side effects as well, which we'll talk about later on.